Okay, doctor, you can start.
Okay, good. Okay, good morning. Let's start with blood. So blood and body fluids. The body fluids are actually divided into two parts, that is intracellular fluid and extracellular fluids. The intracellular fluid, it is around 22 liter and it formed around 55% of the total body water. And extracellular fluid, it is around 18 liter and forms about 45% of the total body water. And this extracellular fluid is divided again into 5 subunits, that is interstitial fluid and lymph of 20%, plasma for around 7.5%, fluid inside the bones, that is again around 7.5%, fluid in dense connective tissues like cartilages, again 7.5%, and transcellular fluid of 2.5%. The transcellular fluid, which includes cerebrospinal fluid, intraocular fluid, and digestive juices, serous fluid, that is the fluid between the pleura, interpleural fluid, pericardial fluid, that is the fluid in the pericardial space, and the peritoneal fluid, that is in the peritoneum. And also there the synovial fluid in the joints and fluid in urinary tracts included in the transcellular fluid. So altogether that is around 45%. Only interstitial fluid and transcellular fluid is a difference, that is 20% and 2.5%. Balance all the other fluids consist of 7.5%. The blood as a whole, it is a fluid connective tissue. So the properties of blood, the most important property is its color. The arterial blood is scarlet blood red in color. Arterial blood is scarlet red because it contains more oxygen. And venous blood is purple red because it is having more of carbon dioxide. And the volume, the average blood volume in a normal adult is around 5 liters. And that is if a young healthy adult weighing 70 kilogram, and it varies according to the build of the person. And the reaction on pH of the blood, it is slightly alkaline, that pH in normal condition, it is 7.4. And specific gravity of total blood is 1.052 to 1.061, and the blood is more viscous than water, and it is due to red blood cell and the plasma protein. So in a nutshell, we can see the plasma part of the blood contain 7 to 8% of solids, 92 to 93% of water, and some gases like oxygen, carbon dioxide, and nitrogen. The organic substances, that is a solid part, the organic substances present in the plasma are plasma protein. They are albumin, globulin, and fibrinogen. Amino acids, that is essential amino acid and non-essential amino acids. Carbohydrates like glucose. Fats, that is triglyceride, cholesterol, and phospholipids. Internal secretions like hormones, enzymes, non-protein nitrogenous substances like ammonia, creatinine, creatine, xanthine, hypoxanthine, urea, and uric acid. Also, antibodies are also present in the plasma. And the inorganic substances we can detect are sodium, calcium, potassium, magnesium, bicarbonate, chloride, phosphate, iodide, iron, and copper. So all these constituents we can check through the blood test. All these things we used to detect through the blood test. And the change in this will leads to diseases, or we can predict the conditions of the patient. So what's are the functions of the blood? The functions, the first one is nutritive. The substance, like all these substances like glucose, amino acid, lipids, and vitamins, which is derived from the food, are absorbed from the GIT and carried by the blood to the different part of the body. And respiration, the foremost important function is respiratory function, because the RBC, which carries the gases, that is oxygen and carbon dioxide, from the lungs to the various part of the tissues, are carried by the RBC. And excretory function, the waste material, waste product formed in the tissue during various metabolic activities are removed by blood and carried to the excretory organs like kidney, skin, liver, and all, and which is then metabolized, cleaned, and excreted. The transport of hormones and enzymes, the hormones which are secreted by the endocrine glands, are released directly into the bloodstream. So the blood or the plasma, which helps to transport these hormones to their target organs or tissues. And also the enzymes. The water balance. The water content of the blood is freely interchangeable with interstitial fluid. So this interstitial fluid will help to regulate the water content of the body, especially in case of hypertension and all. This interchange, or the interchange of water between the blood and the interstitial fluid, helps a lot to regulate the blood pressure. That is next, coming to the acid-base balance, plasma proteins and hemoglobin acts as a buffer, so which regulate the acid-base balance of the body. And again, coming to the body temperature, the high specific heat of the blood, which is responsible for maintaining the thermoregulatory mechanism in the body, that is the balance between heat loss and heat gain in the body. So the blood will carry it is circulating. So the circulated blood from one part to the other, it is getting cooled and it is getting heated by its own. So if we are getting hot, the cool blood from other part of the body will goes to the skin if we are exposing to the sun, unless otherwise it is too hot. So there are separate thermoregulatory mechanisms in the body, and that is in the hypothalamus. The blood is the one which carries particular temperature, or the particular sends the particular temperature to the thermoregulatory centers in the hypothalamus. And the storage function, water and some important proteins like substance like protein, glucose, sodium, and potassium, which are constantly required by the tissue. And these substances are readily available if the blood is present. And these substances are taken from blood during the conditions like starvation, fluid loss, and electrolyte, especially protein like albumin. Albumin is albumin, globulin, and fibrinogen. The plasma proteins are available in the plasma. So in extreme starvation, the case of extreme starvation, these plasma proteins are used up by the body. And the next function is defensive. The blood plays an important role in the defense mechanism, especially the white blood cells are responsible for the defense mechanism, so which provide immunity. And the neutrophils and monocytes engulf the bacteria and bacteria by phagocytosis. So the neutrophils and monocytes are known as the first line of defense. The first line of defense by neutrophils and monocytes, and next coming to the lymphocytes, which develop immunity, the humoral immunity and cell-mediated immunity by the lymphocytes. And eosinophils are responsible for detoxification, disintegration, and removal of the foreign protein, especially parasitic infestations. So these are all about the functions of blood. Let's see in detail about the plasma protein. Plasma proteins, major plasma proteins are three. They are serum albumin, globulin, and fibrinogen. The total protein level in body is around 7.3 gram per deciliter. That is around 6.4 to 8.3 gram per deciliter. And serum albumin, which is around 4.7 gram per deciliter. Serum globulin, it is 2.3 gram per deciliter. And fibrinogen, it is 0.3 gram per deciliter. And the albumin globulin ratio, that is the ratio between plasma level of albumin and globulin, it is an important indicator of a disease involving liver or kidney. So the normal albumin globulin ratio is 2:1. So coming to the properties of plasma protein, the molecular weight of the albumin is around 69,000 and globulin is 1,56,000 and fibrinogen it is around 4 lakh. And the oncotic pressure, the major property is oncotic pressure. The plasma proteins are responsible for the oncotic or osmotic pressure in the blood. So, which is the pressure exerted by the proteins in the plasma. And this oncotic pressure is also known as colloidal osmotic pressure. The colloids of the plasma, which is providing the pressure, that is known as colloidal osmotic pressure. It is around 25 millimeter of mercury. And albumin is the one which plays a major role in exerting oncotic pressure, or colloidal osmotic pressure is majorly exerted by the albumin. And specific gravity of the plasma protein alone, it is around 1.026. And the buffer action, that is acceptance of hydrogen ion, is known as buffer. The plasma proteins are having a 1/6 of the total buffering action of the blood. And the plasma proteins originated in different areas and the different stages of our life. Like during embryonic period, the plasma proteins are synthesized by the mesenchymal cells. And albumin is synthesized first and other proteins are synthesized later. And coming to the adulthood, in adult, the plasma proteins are synthesized mainly from reticuloendothelial cells of the liver. And also a little quantity from spleen, bone marrow, and disintegrating blood cells and general tissue cells, but majority will produced from the liver. So the liver diseases will act upon the plasma protein level, and disintegration or the protein also will affect the renal diseases, because the renal excretion of protein also will be seen in renal diseases. And gamma globulin is synthesized from the B lymphocytes. So coming to the function of plasma protein, the major function is coagulation of blood by the fibrinogen. And defense mechanism by acting as antibodies, immunoglobulin, gamma globulin. So all this will help in the defense mechanism. So these proteins are also called as immunoglobulin. And These antibodies react with antigen of various microorganisms which cause disease like diphtheria, typhoid, streptococcal infection, and so on. And transport mechanism. The plasma proteins are essential for the transport of substances like albumin, alpha globulin, beta globulin. They are responsible for the transport of hormone, enzymes, and all. And the alpha and beta globulin, which plays an important role in the transport of metal like copper and all. And role in maintenance of osmotic pressure. As we said, the colloidal osmotic pressure or oncotic pressure is maintained by the plasma protein. So at the capillary level, most of these substances are exchanged between blood and the tissue by the help of the osmotic pressure in the capillaries. And regulation of acid-base balance. So especially albumin help in the regulation of acid-base balance in the body. Because of the buffering action, we saw that this plasma protein having a higher buffering action. So it produces around 15% of the total buffering capacity of the blood. And viscosity, which the plasma protein provide the viscosity of the blood. And albumin provide maximum viscosity comparing to other plasma protein. And next, coming to the erythrocyte sedimentation rate, the globulin and fibrinogen accelerate the tendency of rouleau formation by the red blood cell. The rouleau formation means which is the piling up of cells, piling up of RBCs in the blood is known as rouleau formation, and this rouleau formation is responsible for ESR or erythrocyte sedimentation rate, which is important diagnostic and prognostic test. And role in the suspension stability of the red blood cells, that is during circulation, the red blood cells remain suspended uniformly in the blood. So it won't settle down on the blood vessel, or it won't settle down as because of gravity. It is uniformly suspended if it is parallel or if it is vertical or horizontal, wherever. All the blood vessels are contain blood which is having RBCs, and it is uniformly suspended. So this property of the RBC is known as suspension stability. The globulin and fibrinogen help in the suspension stability of the red blood cells. And the Trephone substance production. These are necessary for the nourishment of tissue cells in the culture. So these substances are produced by leukocytes from plasma protein, and also which help as a reserve protein. As I said earlier, during fasting or during extreme starvation, inadequate food intake or inadequate protein intake, if the person is deprived of protein diet for a prolonged period of time, the plasma proteins are utilized by the body tissues, that is using as the last source of energy. This don't take up first, the last source. If they are not at all taking for protein for a long period, or even the muscular protein is removed, then again there is a protein deficiency. The last source is plasma protein. The body take up plasma proteins. And let's see the details of the blood components. So we finished plasma. Next, we can see about the RBC or the red blood cells. They are non-nucleated formed elements in the blood. The formed elements are RBC, WBC, and platelet. So the major formed element is RBC and they are known as erythrocytes. The red color of the red blood cell is due to the presence of coloring pigment known as hemoglobin, and the RBCs plays a vital role in the transport of gases, and they are larger in number compared to the other two blood cells like WBCs and platelet. The normal value of RBC, it is around 4 to 5.5 million cubic cells per cubic millimeter of cell, blood. So in adult male, it is around 5 to 5.5 million cells per cubic millimeter of blood, and in females, it is 4 to 4.5 million cells per cubic millimeter of blood. And its shape is a dumbbell shape, that or biconcave shape, which helps in the rapid diffusion of oxygen and other substances into the cell and provide larger surface area for the absorption and removal of the substances. Minimal tension offered in the membrane when the volume of cell alters, or if it because of the biconcave shape, the minute capillaries, through the minute capillaries, the blood cells can move easily, or it can squeeze through easily without damaging. So what are the properties of blood cells? First one is Rouleau formation. So Rouleau formation means when blood is taken out of the blood vessel, the RBCs pile up one above the other like a pile of coins. So this property, or the piling up of RBC, is known as Rouleau formation, which is accelerated by the plasma proteins, albumin, globulin, and fibrinogen. And coming to the specific gravity of RBC, it is around 1.092 to 1.101. And other important property of RBC is packed cell volume. That is the proportion of blood occupied by the RBC expressed in percentage. So it is also known as hematocrit value. It is around 45 to 45% of blood, and plasma volume is 55%. That is packed cells. The cells are packed and how much volume it is occupying. Next one is suspension stability. We have seen it like during circulation, the RBCs remain suspended uniformly in blood. And the lifespan, the total lifespan of the RBC is around 120 days. The old RBC or the senile RBCs are destroyed in the reticuloendothelial system, mainly in the spleen. So, during destruction, what will be the end product? Like during destruction, the hemoglobin is released, and the hemoglobin is converted to iron, globin, and porphyrin. The iron will combine with apoferritin to form ferritin, and which is stored and reused. And the globin part, which is a protein which enters into the protein pool and stored in the protein pool and reused. And porphyrin again converted to bilirubin, and this bilirubin is excreted. This is the end products of destruction of RBC. So coming to the functions of RBC, the RBCs transport oxygen from lungs to the tissue, for that is RBC combined with oxygen to form oxyhemoglobin, and it is transported in blood in the form of oxyhemoglobin. And carbon dioxide by carb hemoglobin, around 30% of carbon dioxide is transported. And hemoglobin acts as a buffer which regulate the hydrogen ion concentration, so which plays a major role in the maintenance of acid-base balance in the body. And the blood group determination is used by the RBC, that is the antigens are present in the RBC like A antigen and B antigen, and also the Rh factor are present in the RBC, which helps in the determination of blood group and enables to prevent reactions due to incompatible blood transfusion. So these are all about the general properties and function of the RBC. Let's see how the RBCs are formed. The RBCs are formed, that mechanism or the method is known as erythropoiesis. That is the process of origin, development, and maturation of the erythrocytes. Hemopoiesis or hematopoiesis is the process of origin, development, and maturation of all blood cells, and from that hemopoiesis, each separate cell is again we are going to see, that is erythropoiesis, leukopoiesis, and all. The erythropoiesis is for, or it is exclusively for RBCs. In fetal life, the RBCs are produced in 3 stages, that is mesoblastic, hepatic, and myeloid state. That is, during the first 2 months, in first 2 months, the RBCs are produced in the mesenchyme of the yolk sac. And next period, that is from 3rd month of intrauterine life, it is known as hepatic stage because liver is the major organ that produce RBC. So liver, spleen, and lymphoid organ which enters into the RBC production from 3rd month onwards, 3rd to around 8th month, and during the last 3 months, 7, 8, 9, the RBCs are produced from red bone marrow along with liver. So first 2 months, it is from the mesenchyme. From 3rd month onwards, it starts producing from liver up to 12th month, up to 9th. But in the last 3 months, the bone marrow also involved in the RBC production. And in newborn babies and children, also in adults, there are different areas of RBC production. That is, in newborn babies and growing children, RBC are produced from the red bone marrow. That is, liver stops producing RBC once the baby is out. So up to the age of 20, RBCs are produced from the red bone marrow of all bones, long bones and all flat bones. So the RBC level is high up, and it is more in the up to 20 years. And after the age of 20, the RBCs are produced from membranous bones like vertebrae, sternum, rib, scapula, iliac bones, and skull bones, and also from the ends of the long bones. So the shaft of the long bones become yellow bone marrow because of the fat deposition and loses the erythropoietic function. Means after 20 years, means once the person get aged, the long bone marrow, the end of the long bonds will get which become turns into fat deposits and which is unable to produce RBC. And in adult, the liver and spleen may produce RBC, that is, if bone marrow is destroyed or fibrosed. Like if it is in need or if it is in an emergency, liver and spleen may start producing RBC. If not, only the membranous bonds will produce RBC and end of the long bonds. But end of the long bonds will stop producing RBC because of the fat deposition in senile after 50 or 60 years of age. And if all these bonds are getting destroyed or all the bone marrow is destroyed, then the spleen and liver may produce once if it is in good healthy condition. So this is the process of hemopoiesis. That is, the cells are started producing from the uncommitted pluripotent hemopoietic stem cell and which converts to committed pluripotent hemopoietic stem cell. And from the committed pluripotent hemopoietic stem cell, which is produced as lymphoid stem cell and colony forming blastocyte. The lymphoid stem cell will produce lymphocytes and the colony forming blastocytes produce colony forming unit E, colony forming unit granulocyte and monocyte, and colony forming unit megakaryocyte. The colony forming unit E or erythrocyte produce RBC. Granulocyte and monocytes produce granulocytes like neutrophil, basophil, and eosinophil, and monocytes. Colonies forming unit megakaryocytes produce platelets. This is the complete picture of the hemopoiesis. And from this, we are going to see the erythropoiesis. So during erythropoiesis, the cell, that is the blast cell from the uncommitted pluripotent hemopoietic stem cell till the RBC, there are so many changes will happen to the particular cell. So that will change the shape, it will change the color, it will produce, it will change its nuclear activity, staining property, and so on. So let's see what are the stages or what all the changes will happen to the erythrocyte. So the colony forming unit erythrocyte pass through different stages. So the important changes are the reduction in the size of the cell. That is the first stage. It is around 25 and it reduced to 7.2 micron. And disappearance of nucleoli and nucleus. We know RBCs are non-nucleated, but during the development, in the first stage, there is nucleus. So gradually it is disappearing. And appearance of hemoglobin. The hemoglobin starts appear in the RBC. At first stage, there is no hemoglobin. Later on, hemoglobin is added into the RBC. And because of hemoglobin and the changes, the staining property also changes. So let's see these stages. They are pro-erythroblast, early nomoblast, intermediate nomoblast, late nomoblast, reticulocyte, and matured erythrocyte. In this diagram, we can see the changes happening into the erythrocyte, that is from the pluripotent hemopoietic stem cell, it forms the colony forming blastocyte to form colony forming unit erythrocyte, the pro-erythrocyte early nomoblast, intermediate nomoblast, late nomoblast, reticulocyte, and erythrocyte. Here we can see the color is changing, the size is changing, and the nucleus is disappearing, and erythrocyte is forming. So, the proerythroblast, it is known as megaloblast. Megaloblast. The megaloblast is the first cell derived from the unit erythrocyte. It is large. It is around 20 micron. Nucleus is large and occupied cell almost completely. The nucleus has 2 or more nucleoli and a reticular network, and which doesn't contain hemoglobin. Proerythroblast doesn't contain hemoglobin, and the cytoplasm is basophilic. And this proerythroblast multiplies and forms the next stage known as early normoblast. During the early normoblast, the cell is comparatively smaller than the proerythroblast with a diameter of 15 micron. Nucleus and nucleoli starts disappearing. The chromatic network goes condensed, and it is a dense condensation, and the cytoplasm is basophilic. So, it is also known as basophilic erythroblast. The cell develops into next stage known as intermediate normoblast. The cell is smaller than the early normoblast, which is the diameter of around 10 to 12 micron. Nucleus is still present, but it is condensed. The chromatin condensation is present. Hemoglobin starts appearing. Remember, in the intermediate normoblastic stage onwards, hemoglobin starts appearing. So the cytoplasm is already basophilic. Now the presence of hemoglobin, which stains the cytoplasm into acidic. So it is acidic and basic. So it is known as polychromatic erythroblast. Polychromophilic. Both these stains are present. So if nucleus is present, the cell is basophilic. Once the hemoglobin starts appearing, then the cell becomes acidic. Next, coming to the late normoblast, the size of the cell decreases it around 8 to 10 micron, and the nucleus become very small with very much condensed chromatin, like an ink spot. It is not, we can't able to say there is a specific basophilic color, and the quantity of hemoglobin starts increasing, and the cytoplasm become almost acidophilic. So it is known as orthochromic erythroblast. Orthochromic erythroblast. In the final stage, the late normoblast, just before it passed to the next stage, the nucleus disintegrates and disappears. So that is known as pycnosis. The final remnant is extruded from the cell. So the late normoblastic stage, the pycnosis happens, the final stage of condensation, or it is disintegrated. And next, coming to the reticulocyte, it is known as immature RBC. It is comparatively or slightly larger than the mature RBC. The cytoplasm contains reticular network or reticulum. That is the final remnants of the disintegrated organelles. Some small fiber-like structures will be there. And due to the reticular network, the cell is known as reticulocyte. And it is seen with supravital stain. And the reticulocyte is basophilic due to the presence of remnants of disintegrated Golgi apparatus, mitochondria, and other organelles of the cytoplasm. And during this stage, the cell enters the blood capillary through capillary membrane from site of production by diapedasis. And finally, the cell will form the matured RBC or matured erythrocyte. The reticular network disappears and the cell became the matured RBC and attains the biconcave shape. Its size is around 7.2 micron and there is hemoglobin and there is no nucleus, which requires, that is around 7 days are required for the development and maturation of RBC from proerythroblast, and 5 days is required from the reticulocyte to reach the reticulocyte, and reticulocyte takes around 2 more days to become the matured RBC. So the factors which are necessary for erythropoiesis are general factor, maturation factor, and the factor necessary for hemoglobin. The general factors are erythropoietin, thyroxine, hemopoietic growth factors, and vitamins. Erythropoietin is the major factor of the hormone and which is having a erythrocyte stimulating action. Thyroxine, that is a general metabolic hormone which accelerates the process of erythropoiesis. And hemopoietic growth factor such as interleukin and stem cell factor. Vitamins like vitamin B, C, D, and E. Vitamin D deficiency cause anemia and pellagra. And vitamin C, again it is essential, which deficiency causes anemia and scurvy. And vitamin D, the deficiency produces anemia and rickets. Vitamin E leads to anemia and malnutrition. So B, C, D, and E are the essential vitamins for the production of RBC. Vitamin B12, what will happen is the vitamin B12 helps in the maturation for the erythropoiesis. An intrinsic factor of cell produced by the gastric mucosa is essential for the absorption of vitamin B12. So, if the intrinsic factor of cell is absent, vitamin B12 is not absorbed, so which produces pernicious anemia. And folic acid, it is essential for the maturation, which is required for the synthesis of DNA. So, if folic acid is absent, the DNA synthesis is decreased, causing failure maturation. And the factors necessary for hemoglobin formation are first-class proteins and amino acids, that is proteins of high biological value, and iron, that is formation of heme part of the hemoglobin, copper, which is necessary for the absorption of iron from gastrointestinal tract, cobalt and nickel. These metals which are essential for the utilization of iron during hemoglobin formation. Vitamins like vitamin C, riboflavin, nicotine, nic acid, and pyridoxine. So, let's see what will happen if there is a decrease in RBC. The anemia, that is the disease condition characterized by the reduction in RBC count, hemoglobin content, and packed cell volume. Means if there is a decrease in RBC or hemoglobin content, which will lead to a disease condition known as anemia. So the general reduction in RBC count or hemoglobin or PCV because of decreased production of RBC or increased destruction of RBC, or if there is a loss of blood from the body. In this state, we can classify anemia into two, that is morphological and etiological. Morphological classification is also known as Winthrop's classification. The morphological changes like normocytic normochromic anemia, normocytic hypochromic anemia, macrocytic hypochromic anemia, or microcytic hypochromic anemia. That is normal cell, normal color, normal cell, decrease in color, small cell with decreased color, large cell with decrease in color. So micro, small, and macro, large. So let us see the etiological classification. The etiology or the cause of or origin, it is divided into 5: hemorrhagic, hemolytic, nutrition deficiency, aplastic, or anemia of the chronic diseases. So hemorrhagic anemia, during acute blood loss, we will get normocytic normochromic. Cell size and color will be normal, but during chronic loss of blood, the cell size will decrease and also color will decrease. Microcytic hypochromic. And hemolytic anemia, like extrinsic hemolytic anemia, like during liver failure, renal disorders and all, or poisons or isoglutinins or autoimmune diseases. During all these conditions, we will get normocytic normochromic cells. But the intrinsic hemolytic anemic conditions or during hereditary disorder like sickle cell anemia and thalassemia, structure of the RBC will change. That, like in sickle cell anemia, the cell will be sickle shape, and thalassemia, the cells shows a small and irregular shape. And in nutrition deficiency anemia, morphologically, iron deficiency, the cell will microcytic and hypochromic. In protein deficiency, the cell will macrocytic and hypochromic. During vitamin B12 deficiency, the cell will be macrocytic normochromic or hypochromic. And in folic acid deficiency, the cell will become megaloblastic because the first stage, megaloblast, because the cells, the DNA synthesis itself is affected. So it is megaloblastic hypochromic. And in aplastic anemia or bone marrow disorders, the anemic or the cell size will be normocytic and normochromic. And in chronic diseases like inflammatory diseases also produces anemia, like rheumatoid arthritis, infections like tuberculosis, renal failure, neoplasms like Hodgkin disease. All these stages we produce normocytic normochromic anemia. So the signs and symptoms as general: skin and mucous membrane, there is a paleness of the skin and mucous membrane. It is more prominent in buccal and pharyngeal mucous membrane, conjunctiva, lips, earlobes, palm and nail bed. And skin loses the elasticity and become thin and dry. Also, thinning, loss and early grayness of hair will produce. The nails will become brittle and easily breakable. There is an increase in heart rate or tachycardia. Heart is dilated and cardiac murmurs will be produced. And velocity of blood flow is increased. There is an increase in the rate and force of respiration, which leads to breathlessness and dyspnea. Hemoglobin dissociation curve is shifted to right. Oxygen hemoglobin dissociation curve or ODC shifted to right and produce anorexia, nausea, vomiting, abdominal discomfort, and constipation. In pernicious anemia, there is atrophy of the papillae of tongue, that is especially in pernicious anemia. And in aplastic anemia, necrotic lesions in mouth and pharynx are present. And basal metabolic rate increases in severe anemia, and renal functions are disturbed. Albumin is common. Menstrual cycle is disturbed in females. Menorrhagia, oligomenorrhea, or amenorrhea will be seen. And in neuromuscular system, common neuromuscular symptoms are increased sensitivity to cold, headache, and constant lack of concentration, restlessness, irritation, weak muscles, and fatigue conditions will be seen in the neuromuscular junction. So by this, we are finishing the RBC, and it's related conditions like anemia. So thank you.